Hey guys, so today I'm here showing you how I redress my surgical wound and clean it so my legs are swollen, especially the right leg, which I just had the total knee replacement on. So my physical therapist was here yesterday, and he didn't change the wound because we were doing exercise. So I noticed when he left, I guess from me moving the leg around so much and sweating or whatever, that it just didn't look too clean. He told me that he will do it when he come back Friday. Today is Wednesday, so I say, you know what? You guys know I've been a medical assistant for years. I've been in the medical field since I came out of high school. When I went to a nursing college course. So, and plus I worked in the doctor's office, pediatrics office, geriatrics office. So I know how to clean a wound and redress a wound. So I thank God for those skills. So what I did yesterday when he left, and I noticed that I didn't like the way it looked. So I said today, let me just go in and do it myself because he comes back Friday, which is 2 days from now. So he can redo it, as he liked. But so what I did, I took off the old dressing then because it was looking a little gooky. So I took off the old dressing and I washed my hands and I put on gloves and I started cleaning on top of the wound and on the side of it because I still had the sutures in, as you can see, guys. So after I washed my hands, I started using the sanitizing cleaning solution that you know, takes the germs and stuff away. So I use that. Then I use some alcohol. So I didn't put the alcohol directly on the spot where the sutures are, but I did use the other stuff and I just cleaned around it, made it nice and clean, kept it a little dry, didn't want it all wet. Excuse the little lumpy legs. It is what it is. If you've been standing a lot like I have and gaining and losing weight, you'll have lumpy legs too. But anyway, I'm proud of the journey that I'm on. I was in a lot of pain the last couple of days, but I'm not a woman that like to complain. You probably wouldn't know that because every time since this knee surgery was about to happen, I've been complaining because I've been in a lot of pain, but that's okay. So now what I'm doing, I'm putting the long strip of tape on with a little piece of gauze in the middle of it, and that's the way it is. So what I'm doing now, I'm just putting the hair tape onto the scar itself, guys. And you have to keep your hands clean and stuff when you're doing this. I'm sorry, I'm chopping up an apple as I'm doing a voiceover. I'm finally in the kitchen, my first day making me something to eat. And I don't want to eat fattening food, so I'm eating a nice coleslaw with southwestern corn, and I'm putting a green apple in it. And I'm also making some Buffalo Wild Alaskan bites. And I'm also putting in a red onion with the cold. This is very fragile. I have the tape on it. So you have to be very careful with this. This is like breathable tape. So easy to rip. You don't want it too tight because you want it to be able to breathe. Now we're going to put our balls around it. Bring this one around. And there we go, guys. And that's going to hold us until, see, it's movable. That's going to hold us until the physical therapist come back Friday. Today is Wednesday. So by the grace of God, this will hold until Friday. And that way I have it on and it still can breathe through, because when you have an open wound like that, even though it's sutures in it, you have to make sure you keep it dry. And you have to be able to let air flow through or you will get it infected. So that is it, guys. Showing you how to rewrap a wound area. This was a total knee replacement, which was done a week from today. And this should hold me until my physical therapist come back to give me the proper wrapping. Thank you, guys. Thank you for joining me. This is your girl, Miss Debs. God bless. And I just wanted to tell you, I brought some of these from the hospital. These are just like care bags, like once you finish with stuff that you're using that you don't want to have around you anymore. So I'm just putting it in a bag, discard it properly. I used a little bit of this sanitizer to clean around the wound and dab it a little bit on the wound. So yeah, that is it, guys. I'm going to show you just how it looks again. I don't have it tight because you want it to be able to breathe and you want to be able to move. So see that? I can do this just a little bit tighter here. All right, there we go, guys. Look at that. And I still can do my exercise with it. See? That's what I do every day just to keep the knee joint mobile. Straighten up. And it won't come off. So you want to make it so you can move with it when you're doing your exercise and stuff like that. But you, like I said again, you don't want it too tight because you want to be able to expand, like for the leg to move. So that is it, guys. And I just want to come back and show you that, how it looks once it's all together. And when you sleep at night, you probably would just like keep a soft pillow between your leg so it won't be friction between the mattress and the gauze and stuff that you put on your leg to help protect the wound. Thank you. Bye-bye.